A large challenge with combating mental illness stigma is a lack of accurate information and an overwhelmingly inadequate education on mental health topics. Without proper knowledge of mental health and mental illness, people tend to categorize mental illness as a singular disease with one set of symptoms. This often leads to stereotyping those who suffer from mental illness as dangerous and threatening. In reality, mental illness refers to a wide variety of disorders and conditions that range in severity and all manifest with different symptoms. Participating in these negative stereotypes and the associated stigma encourage discrimination and can inhibit those suffering from mental illness from seeking help. To combat this, proper access to information through widespread education is necessary. Studies have shown that although education can be beneficial at multiple ages, mental health education has the greatest impact with individuals younger than young adults. As children age, they begin to internalize negative stereotypes, and these pre-existing attitudes lower the effectiveness of educational initiatives. When individuals come in with a negative or positive attitude regarding mental illness, those with positive attitudes tend to gain more from educational initiatives. These educationally focused initiatives can be implemented in conjunction with school health class, after-school programs, or even into sports. In addition to formal education methods, informal education plays a large role in reducing the stigma and increasing the knowledge regarding mental illness, and specifically substance use disorder. The most important factor in education is to pass on factual information. Other forms of education include peer groups, Mental Health Awareness Month, and even social media. The internet and social media have an ever-increasing presence and influence on people's lives, and can serve as an effective tool for promoting mental health awareness and destigmatizing mental illness. Specifically, social media, TikTok, and Twitter enable people struggling with mental illness to share their story with countless other individuals and promote positive education, and to emphasize that no one is alone in mental illness. Recently, celebrities have begun to open up about their own struggles with mental illness on these platforms and serve as role models, ultimately reducing stigma and encouraging those struggling to seek help. Media in all of its forms has become the public's most influential source of information regarding mental health and mental illness. Positive and negative stereotypes of those struggling with mental illnesses, and specifically substance use disorder, inundate news media, television, radio, and social media, reaching almost all demographics. Often, these forms of media contribute to an overwhelming sense of stigma surrounding mental illness through exaggerated, comical, and inaccurate portrayals of individuals who struggle with their mental health. The media often stereotypes and groups individuals suffering from a range of disorders into one category as a person who is dangerous and should be feared. People struggling with their mental health are often portrayed as violent, murderous, unpredictable, and are to blame for their illness. These media portrayals can even override one's personal experiences with people who struggle with mental illness and further contribute to negative stereotyping. The news media yields great influence in the public perception of real people who struggle with mental illness, and specifically substance use disorder. News outlets often over-dramatize and exaggerate crimes committed by those suffering from mental illness for increased views, leading to increased stigma towards those suffering from mental illness. Given the overwhelming influence of the media on a public perception of mental illness, there is also great potential for the media to influence the public in a positive manner. Celebrities have taken to social media platforms such as Instagram, TikTok, and Twitter to share their personal struggles with mental illness and substance use disorder, which has helped open the conversation about the realities and humanity of mental illness. Additionally, by humanizing mental illness through personal stories from recovered patients, encouraging those who are suffering to seek help, and communicating accurate information, the media has the potential to be an invaluable ally for those learning about or struggling with mental illness.
We encourage anybody who notices a stigmatizing, harmful, or inaccurate report on substance use in the media to avoid being silent and to reach out to the editor to let them know how the story is potentially damaging. For those involved with news media, it's incredibly important that stories about individuals suffering from substance use disorders are delivered accurately, responsibly, and in a way that humanizes the person suffering. Here are some tips on how to responsibly report on substance use. First, distinguish between use, abuse, and dependence. Substance use can refer to consumption of a substance that does not inherently cause health or dependence issues. Abuse of a substance causes physical or mental harm to the user or those around them. Addiction or dependence causes the user to forfeit their ability to make choices that take them away from their substance use, and is classified as an illness by the World Health Organization. Anybody who uses a potentially addictive substance like alcohol is not necessarily addicted, and people who are suffering from a substance use disorder do not have a bad habit. Their brain chemistry has been altered. These different situations should not be lumped together, and including clear distinctions is a crucial element to responsible coverage of substance use and addiction. Secondly, it's important to emphasize the circumstances that trigger substance use. Media has an important informative role, and ought to fully explain the difficult circumstances that often lead a person down the path of addiction. These might be factors like homelessness, abuse, peer pressure, or self-medication of mental health issues like depression or anxiety. When media outlets avoid telling the whole story of a person's addiction history, they fail to fully humanize that individual and do not allow their audiences to understand and empathize with them as a person.